Good day, I am Jasmine Medal Sudanyo from BSN 111B, and for today's video, I will be performing a written demonstration of abdominal assessment. So assessing the patient's abdomen can provide a critical information about his or her internal organs. So assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. So changing the order of these assessment techniques could alter the frequency of bowel sounds and make the findings less accurate. So in the pre-introductory phase, first thing to do is to review the client's medical record and the doctor's order sheet if available. So I have here the client's medical record, and it's written here that my client for today needs to have an abdominal assessment. So after determining the scope of the assessment needed, prepare the necessary equipments, and these materials are tape measure, ruler, a marker, and a broken tip applicator for the hypersensitivity test of the patient, and of course the stethoscope for auscultation. So completeness and organization of the equipment ensures our efficiency as nurses. So after that, we will be performing a hand washing and then gloves is if necessary to protect the client as well as myself from the spread of microorganisms and the illnesses that they may cause. So now let's proceed to the introductory phase. So first, greet the client politely and introduce yourself, and then verify the client's identity. Good day, ma'am. How are you? I'm good. I am Jasmine Medal Sodanyo, your student nurse for today. May I see your wristband, please? Kindly state your name and birthday. Jeremy Sodanyo and November 21, 2009. And how would you like me to call you, ma'am? Jeremy. Okay, so nice to meet you, Ma'am Jeremy. So today, I am assigned to assess for your abdomen. So to do this, I may have to ask you to remove your shirt and reveal your abdomen so that I can properly check if there are any abnormalities on your abdomen. So, and also I am going to inspect, auscultate, percuss, and palpate your abdomen. So will that be all right with you, ma'am? Yeah. Okay, so before we start, do you have any questions or concerns? No. All right. So if ever you have any concerns or questions, um, or if ever you're uncomfortable, then you are feel free to approach me anytime. Okay. Okay. So that's great. So and how about now, ma'am? Are you comfortable? How about the temperature? Okay, great. And also, ma'am, I have already closed the curtains and the doors for you so that you will be comfortable um during the assessment, and also to protect your privacy and confidentiality, and also so that you won't be distracted during the assessment. Okay. To ensure that the assessment setting is safe, secured, and free from distraction. So and then position the client to be seated comfortably. So in women, drape the anterior thorax when it is not being examined. And of course, I have to ask my client to empty her bladder before beginning the examination to eliminate bladder distension and interference with an accurate examination. So, ma'am, before we start, do you want to use the bathroom first so that you will be more comfortable during the assessment? Yeah. Okay. So here, ma'am. So we are now in the working phase. So here we will first survey the abdomen of the client. So I have to assist the client to lie supine with the arm folded across the chest or rest by the side. So raising the arm above the head or folding them behind the head will tense the abdominal muscles. So these positions best promote relaxation of the abdominal muscle. So, ma'am, can you please lie down? So now I will slightly flex the client's legs by placing a pillow or a rolled towel under the client's knees to help relax the abdominal muscles. And now drape the upper and lower parts of the body, just leaving the abdomen exposed so that the abdomen is visible from the lower rib cage to the pelvic area. Now I am going to observe the abdominal skin. So during the inspection, we have to note any vascularity and spray or stretch mark, and also observe the coloration of the skin and assess for scars, lesions, and rashes. So I don't see any vascularity, stretch mark, or lesions in the client's stomach. Also no scars and rashes as well. So if scar is noted, ask the client about the source of the scar and use a centimeter ruler to measure the scar's length, because scarring might be an alert for possible internal adhesions. And of course, document the location for quadrant and reference line, shape, length, and any specific characteristics. So now inspect the umbilicus for its color, contour, and location. So the color of the client's umbilicus is similar to the surrounding abdominal skin tones, and its location is in the midline and at lateral line, and it is inverted. So now let's start examining the abdomen. So first, I have to inspect the contour of her abdomen, whether it is round, flat, or distended. So to do this, I have to sit at the client's side and look across the abdomen at a level slightly higher than the client's abdomen. Okay, so as I can see here, the client's abdomen is flat, which is normal. So next, I will inspect the abdominal girth. So inspect the area in between the lower rib and pubic bone, and note for any abdominal enlargement. So abdominal girth is used to diagnose and monitor the buildup of fluid in the abdomen. So most often caused by liver and heart failure or any cancer that spread widely throughout the abdomen. Okay, so I don't see any bulges or enlargement of the on the abdomen of my patient, which is a sign of normality. So next is to measure the abdominal girth using a tape measure at the same time of the day, ideally in the morning. So first, we have to ensure that the client has emptied her bladder. So ma'am, before we measure your abdominal girth, do you want to use the bathroom first? No. Okay, so if not, then can you please stand up? So in measuring the abdominal girth, the ideal position for the client is standing. And otherwise, the client should be in a supine position. The client's head may be slightly elevated for the of orthopnic clients. So use a disposable or easily clean tape measure and place the tape measure behind the client and measure starting on the umbilicus and record the distance in designated units like inches or centimeters. Now ask the client not to wash the mark off until it is no longer needed. So mom, I have marked that area of your abdomen so that it will be easier for me and for the next nurse to locate and measure again your abdominal girth. And of course, as much as possible, do not wash or erase that mark, okay? Okay. Okay. Now I have to assess for the symmetry of the abdomen. So To do this, ask the client to raise her head to further assess for herniation or diastasis recti, such as bulges. So, ma'am, can you please raise your head? Okay. So I don't see any bulges or any signs of herniation and diastasis recti. So now inspect the abdominal movement when the client breathes and observe for peristaltic waves. So this procedure is important for us to identify if the patient has abnormalities like intestinal obstruction. So ma'am, can you please inhale, exhale? Okay, so I don't see any inhale. Okay, so I don't see any abdominal movements aside from the respiratory movement, which is normal. So normally, peristaltic waves are not seen, although they may be visible in very thin people as slight ripples on the abdominal wall. So after inspection, let us now proceed to the examining of the abdomen through auscultation. So first is to auscultate for bowel sounds. So to do this, use the diaphragm of the stethoscope and make sure that it is warm before placing it on the client's abdomen. So we will use the diaphragm of the stethoscope because it is best for detecting high-pitched sounds such as bowel sounds. So apply light pressure or simply rest the stethoscope if the abdomen is under if the abdomen is tender or painful. So, ma'am, I will be placing the diaphragm of my stethoscope on your abdomen now. Please tell me if you feel any pain, okay? Okay. So the client did not feel any pain or tenderness. So now we will perform auscultation starting with the right lower quadrant and then clockwise. So we will listen to each quadrant for 5 minutes to confirm the absence of vowel sounds and note the intensity, pitch, and frequency of the vowel sounds. And the increasing pitch of the vowel sounds is most diagnostic of obstruction because it signifies intestinal distension. And after 1 minute, place the diaphragm to the right upper quadrant and then to the left upper quadrant and then the left lower quadrant. So, for instance, the client is experiencing pain at the right lower quadrant, then we will skip the right lower quadrant and then auscultate first the right upper quadrant, then clockwise. So, making the right lower quadrant last to auscultate. So, this is done so that the patient will not feel any pain while auscultating the rest of the quadrant. So, next is to auscultate the vascular sounds. So, auscultating for vascular sound is important, especially if the client has hypertension or if you suspect arterial insufficiency to the legs. So, using the bell of the stethoscope, listen for bruits over the abdominal aorta and renal, iliac, and femoral arteries. So, now we will be listening through the bell because it is best for lower pitch or murmur-like sounds such as bruits. So, also, bruits are not normally heard over abdominal aorta or renal, iliac, or femoral arteries. However, bruits confined to systole may be normal in some clients depending on other differentiating factors. So now I have to auscultate the venous hum using the bell of the stethoscope in the epigastric and umbilical area. So this area is the epigastric and this is the umbilical area. So I have to auscultate it using the bell of my stethoscope. Okay. So I did not hear any venous hum, which is normal. So next, let's auscultate for a friction rub over the liver and the spleen. So place the diaphragm of the stethoscope over the right and left lower rib cage, and then listen for friction rub. So now I am now going to auscultate for a friction rub over your liver and spleen. Spleen, can you please inhale and then exhale? Okay. Inhale, exhale, inhale, exhale, inhale, exhale, inhale. Okay, thank you. So friction rubs are rare if heard over the lower right costal area. So it is associated with hepatic abscess or metastasis. And if a rub heard at the anterior axillary line in the lower left costal area, it is associated with splenic infarction, abscess, infection, or tumor. So we are now done with the auscultation. So let us now proceed to examining the abdomen through percussion. So first is to percuss for tone. So lightly and systematically percuss all quadrants. So percussion may proceed clockwise or up and down over the abdomen. So now we have to percuss several areas in each of the four quadrants to determine the presence of tympani and dullness. So that's several areas of each quadrant composed of 13 specific areas. So the normal findings of that is tympani predominates over the abdomen because of air in the stomach and intestines. So normal dullness is heard over the liver and spleen. So before we percuss, let's locate first the 13 specific areas over the four quadrants. So in the right lower quadrant, we have three specific areas. And then on the and then on the right upper quadrant, we have four. One, two, three, four. And on the left upper quadrant, we have three. And same thing on the left lower quadrant, we have three. So now let's percuss. So next, we have to percuss the span or height of the liver by determining its lower and upper border. So to do this, first we have to determine the lower border by percussing. So beginning from the right lower quadrant at the mid-clavicular line, then upwards. So then note the change from tympani to dullness, and the purpose of this percussion is to measure the size of the liver. So first, let's locate the parts. So this line is the mid-clavicular line um because it is the line passing through the clavicle. So now we will start percussing at the right lower quadrant, and we will be noticing a tympanic sound to dullness. Okay, so the dullness starts in this area, and I will now mark this area. And this is called the liver border of dullness. Okay. So next is to assess the descent of the liver. So first is to locate the liver border of dullness. So which is here where I left the mark. So now I will ask the client to take a deep breath and then hold. So ma'am, can you please take a deep breath and then hold, please? Okay, you may now exhale. So next is to assess the upper border by percussing over the upper right chest at the mid-clavicular line and percuss downward. So then mark the point. Note, noting the change from lung resonance to liver dullness. So that is the upper border of liver dullness. So we have to start at the right upper chest at the mid-clavicular line. Now I have to mark it. So now I have to measure the distance between the two marks using a ruler, and that I'm going to use the centimeter, which is 3 centimeter. It is 3 centimeter, which is normal. So that is uh, the one that I measured just a while ago is called the span of the liver. So now I have to repeat the percussion of the liver at the mid-sternal line. So next, percuss the spleen starting on the posterior to the left mid-axillary line, and percuss downward and note the change from lung resonance to splenic dullness. So when we say uh when we say mid-axillary line, this is the mid-axillary line on the left. So we have to percuss downward. So now I have to perform a second method of percussing to determine the splenic enlargement by asking the client to take a deep breath and start percussing um on the last left interspace at the anterior and axillary line. Ma'am, can you please take a deep breath and hold it a minute, please? So now I'll perform the blunt percussion on on the liver and kidney. So this is to assess for tenderness in difficult to palpate structures. So let's start percussing first the liver. So ma'am, can you please sit down? Okay, so to do this, I have to place my left hand against the lower right anterior rib cage and use the ulnar side of my right fist and strike the left hand and denote for any tenderness upon percussion. Okay, so now I have to percuss the kidney at the um at the costovertebral angles over the 12th rib. Can you please face that side? Okay, you may go back. So next is to test for abdominal distension, bulging flanks, or aside. So first, I have to percuss the flanks from the bed upward towards the umbilicus and note the change from dullness to tympani and mark this point. Now I am going to perform the fluid wave test. So ma'am, can you please place your this side of your hand and your forearm at the middle of your abdomen? Okay, like that. So to do this, place the firmly place the palmar surface of your finger and hand against the one side of the client's abdomen and note for any fluid movement. So we are now done with the percussion. Let us now proceed to examining the abdomen through palpation. So first, position the client back in a supine position. So as you can see, my client is already in a supine position. So then cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. So next, begin palpating on a non-tender abdominal quadrant by using the fingertips to compress the quadrant to a depth of 1 centimeter in a dipping motion. So of course, we will begin palpating at the right lower quadrant because my patient doesn't have any non-tender areas. So now I have to palpate deeply all quadrants to delineate organs and detect subdural organs using the palmar surface of my fingers to compress the quadrants to a maximum depth of 5 to 6 centimeters. And of course, note any resistance or any deeper structures. So if resistance or deeper structure is felt, perform by manual palpation. So next, palpate for muscles using the fingertips to compress all the quadrants to a depth of 1 centimeter in a dipping motion and note for any muscles. So if muscles were found, take note of its size, location, shape, consistency, tenderness, and mobility. So next, palpate the umbilicus and its surrounding and take note for any swelling, bulges, or masses. So next, palpate the aorta by using the thumb and the first finger or use both hands to palpate deeply on the epigastrium. So slightly to the left of midline and assess for pulsation. So next, palpate the liver by standing at the client's right side and place the left hand under the client's back at the level of the 11th and 12th ribs. So then lay the right hand parallel to the right costal margin. So ma'am, can you please take a deep breath, please? So while the patient is inhaling, compress upward and inward with the fingers. Normally, the liver is not usually palpable, although it may be felt in some thin patients. So next, palpate the liver by hooking. So stand at the right of the client's chest and curl the fingers of both hands over the edge of the right costal margin. So ma'am, can you please take a deep breath again, please? So now gently but firmly pull inwards and upward. Okay, again, so this is the hooking technique. Okay. So if you palpated an enlargement, so it may be due to hepatitis, liver tumors, and vascular enlargement. So next, test for the cholecystitis by pressing the fingertips under the liver border at the right costal margin and ask the patient to inhale deeply. So ma'am, can you please inhale again deeply, please? So next is to palpate the spleen. So there are two ways in which you can palpate the spleen, but right now I choose the method to impalpate it. So to do this, first is to ask the client to turn onto his right side. So ma'am, can you please turn on the right side, this right side? Here, ma'am. Face. Then palpate the spleen by moving it downward and forward, and then document the size in centimeters below the left costal margin. So the spleen is seldom palpable at the left costal margin, and if the edge of the spleen can be palpated, it should be soft and non-tender. So ma'am, you can now go back to my position. So next is to palpate the kidney by placing the left hand on the right posterior flank. So then place the right hand on the right upper quadrant just below the costal margin at the mid clavicular line, and then ask the client to exhale and hold briefly. So ma'am, can you please inhale and then exhale? And now I will repeat the steps for the left kidney. Okay, can you inhale now? Okay, hold it and then exhale. So the kidneys are not palpable, which is normal. So sometimes the lower pole of the right kidneys may be palpable, and if palpated, it should be it should feel firm, smooth, and rounded. So next, perform hypersensitivity test. So to assess if this is to assess if the patient is sensitive to pain or has an exaggerated skin reaction. So to do this, stroke the abdomen with a sharp object and quickly let go. So repeat this step several times along the abdominal wall and note for pain or exaggerated skin reaction. So next is to test for the Pissowa sign, which can be seen in some patients with appendicitis. So first, ask the client to lie on the left side and hyperextend the right leg, and note for pain and reaction of the client. So ma'am, can you please look at ma'am? Can you please face that side? Okay, ma'am. So I'm now going to hyperextend your leg. So my patient is negative for Pessoa sign because she did not feel any pain or during she did not feel any pain during the test. So next is to test for obturator sign. So to do this, hold and support the client's right knee and ankle, and then flex the hip and the knee and rotate the leg internally and externally. So again, note for pain and reaction of the client. Lastly, test for appendicitis. So assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. So suddenly release the pressure, then listen and watch the client's reaction for pain. So ma'am, I will now assess for your appendicitis. Okay. Does it hurt when I press this area, ma'am? No. How about when I release it? No. Okay. So we are now done with the assessment and we are now in the summary and closing phase. So now I have to help the client put back her clothes on and position her comfortably into the bed. So next, summarize the information obtained during the working phase and discuss the findings to the client. Discuss to the client the possible plans to resolve health concerns if present, and assess for clients' understanding of the plan and the need for further teaching. So, ma'am, we are now done with the assessment. Let me just summarize everything for you. So, upon inspecting the abdomen, I did not notice any scars, venous engorgement, and the contour is flat, and your skin color is uniform with no lesions. And upon percussing the abdomen and liver, the sound over abdomen is tympanic, and no tenderness are located. And for the palpation, um, no tenderness was noted, and your abdomen was smooth and consistent and has consistent tension. And your liver span is 11 centimeter, which is normal. And your spleen and kidneys are not it is not palpable, which is also normal. And that's it. So overall, ma'am, everything in your abdomen is normal. So now, ma'am, I noticed that your skin is dry. So I suggest drinking water more frequently to hydrate your skin, and it will also help your body to absorb vitamins and nutrients from your food, which will increase your chances of staying healthy. So do you understand, ma'am? So do you have any more questions or clarifications? Okay, so if not, okay, so that's it. That's all for today, ma'am. So that's all for today, ma'am. Thank you for cooperating and have a nice day.